All right, guys, we're on the Medicare.gov website. I want to show you how to find a plan. Now, previous videos, I'll leave links to those down below. I talked about how to find your Medicare drug plan. Let's do the same thing for Medicare Advantage plans. Right now, we're in the annual election period, AEP, which is the time of year, if you're currently on Medicare, that you can choose your plan for next year, starting January 1st. So this is the Medicare homepage. So what we want to do is we want to scroll down here. We go to Find Health and Drug Plans right here. Find plans now. This is where you want to put your zip code in. We're looking at 2025 plans. If we're going to put in 89121, this is in Las Vegas, Clark County, but just put your home zip code. Now we want to choose, there's three options of plans we can look at. We're going to look at Medicare Advantage Part C plans. Most Part C plans include the drug coverage and also include the Part A and Part B of Medicare. So this is a good way to get your benefits. If you currently have a Medicare Advantage plan, I'd recommend going through this process every year to see how it's covering your medications. All right, this next step's asking you, do you get help with any of these extra programs here? I'm going to assume you don't qualify and go next. And yes, we want to see drug costs as we compare plans, because that's the beauty of this tool, is it shows us which plans give us the best pricing. So we're going to enter a few drugs here. We're going to put in atorvastatin, that's Lipitor. We'll add another one here. We'll add finasteride. And then let's add an expensive brand name medication here. Let's put in Eliquis. Okay, it's helpful. It's going to be most accurate if you can put in your dosage. So you want to make sure you're getting the correct dosage and the quantity that you get. So this it defaults to 5 mgs, 2 a day, or you get 60 per month that you take that. Add that to our drug list. Now we have our drug list complete. We scroll down to the bottom. Done adding drugs. Now this is very critical on which plans it's going to recommend for you. Now it's showing pharmacies just based on my zip code, but you can type in a pharmacy name here, like let's say you go to CVS or Walgreens or Target, maybe a grocery store. This is a Smith's grocery store, Kroger, Save-On Pharmacy. We've got all kinds of different. We're going to add a Walgreens, we're going to do CVS, and we're going to do a grocery store, Smith's. You can add up to 5 different pharmacies. So see these blue squares down here at the bottom? These are where your pharmacies are added, and we can add on a mail order, so it'll calculate the mail order cost, because all these plans have their own mail order programs. Down here in the bottom right, we just go to done. All right, it's calculating for us now. Now what we want to look at is the lowest. It defaults to showing us the lowest drug plus premium cost, so we can do it by lowest monthly premium, but we want to see the lowest plan cost and drug cost combined on these plans. Okay. Now, this plan here is showing us, it shows our total cost for the year. This is the total estimated cost for the year. This is the plan name here, Select Health Medicare Kroger. This is going to show your maximum out of pocket in network. This one, $376 on that one. And then as we go down the list here, the drug costs are only going to increase. 362. That one's 362. Humana 373. So they're just going to keep going. Now, to give you an idea, look right here. You see this number here? It says 10 out of 38 Medicare Advantage plans. In this area, there's 38 Medicare Advantage plans. Quite a few. It makes sense to go with the one that's going to give you the lowest drug cost, but here's also what you need to do is you need to figure out if your doctors are on this plan in the network. So what you can do is you can go to this plan's website. So if you go to the Select Health website, you can find doctors, put all your doctors in to see if it's going to meet your needs for doctors. So it might be cheap on drugs, but it may not cover your doctors. So then if that one doesn't cover your doctors, then we would go down here to the next one, Alignment Health Platinum. We would check out their website, check our doctors against their network, see how it stacks up. If they don't, then we kind of just go down the list here and see which one's going to give us the best coverage. So that's a way that you can find, guys, you can even apply. You don't need to use an agent. You can just apply for the plan right here on the Medicare.gov website. Just go to Enroll Now. Okay, you can go to Enroll Now, join the plan. You can just put your information. All you need is your red, white, blue Medicare card to join the plan. This also gives you, if we go to plan details, this will also give you the plan's phone number. So right here, there's the non-member phone number. You can just call that up and you can enroll right over the phone if you want to. So that makes it also easy to do. So guys, this is something that you can do. You don't need to have an agent or broker work on this for you. You can do this yourself. It's helpful to have all your drugs entered in and then check your doctors against the plan's network on their website and see which plan is going to be to give you the lowest drug cost, that and also have all your doctors. So guys, thanks for watching the video. Be sure to hit that thumbs up button, subscribe to the channel, and we'll see you in the next one. Thanks.